Hello and welcome to the Spectrum Health Cardiac Rehab Education series. My name is Grayson. I am an exercise specialist with Spectrum Health Cardiac Rehab, and this presentation will focus on the fundamentals of strength training. Strength training is important, especially as we age, because it helps us to maintain our independence. Keeping our muscles strong and active allows us to maintain our regular daily activities, such as carrying the laundry, carrying the groceries, mowing the lawn, and as the human body ages, we naturally lose muscle and bone density. With this loss in strength, individuals often have challenges with balance. Strength training not only helps to improve balance, but it also helps improve bone density. So an individual who participates in strength training is A, less likely to fall because of their improved balance, and B, less likely to sustain a bone fracture due to their increased bone density. Strength training also improves our safety with higher intensity activities and enables us to return to activities or hobbies that require increased strength. It is important to warm up the body before participating in strength training. Warming up allows the body to adjust to the increased demands of exercise. Engaging in a warm-up will also reduce the likelihood of symptoms, improve range of motion, reduce the risk of injury, and can even improve performance during exercise. A quality warm-up should consist of 5 to 10 minutes of light to moderate aerobic activity. At the end of your exercise, it is equally important to cool down. Cooling down allows the body to recover safely, giving your heart rate and blood pressure time to gradually decrease. Stretching is a great way to cool down following exercise. To continually increase strength over time, it is important to follow the overload principle. Overload refers to the amount of load or resistance providing a greater stress on the body than it is normally accustomed to. As we engage in strength training, our bodies adapt to the increased demands that we present it. For example, if a sedentary individual were to start doing 10 push-ups each day, the first day might be a challenge. But as they continue with 10 push-ups each day, the activity will become easier and easier because their body will get stronger as it adapts to the demands presented each day. Eventually, the body will plateau as it has adapted to the 10 push-ups each day. In order to gain strength beyond this plateau, the body must be presented a higher demand. So the individual would either need to do more push-ups or a heavier weight with their push-ups or exercise. While engaging in strength training, the intensity level should feel moderate to hard. The activity should feel challenging for you. However, if you are struggling to finish your last few repetitions, then you're probably doing too much weight. Try to start by finding a weight that you can lift for 1 to 3 sets of 10 to 15 repetitions. To receive the biggest benefit from weight training, aim for 2 to 3 days per week and always allow a day of rest in between the days that you are engaging in strength training. The convenient part of strength training is that there are many different modalities and you can do it almost anywhere, even at home. Strength training can involve hand weights or free weights, resistance bands, machines, household items, or even your body weight. To reduce the risk of injury, it is important to use proper technique. Strength training exercises should be done in a slow and controlled movement, focusing on the target muscle group. Try to avoid twisting or throwing the weights, as that may result in an injury. Counting 1, 2 on the way up and 3, 4 on the return can help to slow and control the movement. Always remember to breathe during any exercise. It is best to try to exhale with exertion. So breathe out when you are doing the hard part of an exercise. For example, with the shoulder press exercise, I'm pressing the weights above my head. So when I'm pushing the weights up, I should be exhaling or breathing out. And then when I'm bringing the weights back down to my shoulder area, that's when I should be breathing back in. But it's important to never hold your breath while exercising. The most important thing is that we're always breathing. For progression, start by increasing repetitions and sets. For example, let's say an individual started weight training with 5 different exercises. They completed one set of each exercise for 10 repetitions. The next time they do strength training, they can either do a second set of each exercise, or they can do each exercise once, but for more than 10 repetitions. Once an individual can do 3 sets of 15 repetitions with good technique, the next time they should increase the weight or resistance that they're using. When increasing weight, however, try to decrease the repetitions back to 10 to help with the transition of the increased load. This slide has listed some common strength training myths. It's important to remember that strength training is used to help us maintain independence and keep us able to do our regular daily activities without any limitations. Strength training should be included in a well-rounded routine with aerobic exercise, stretching, and a heart-healthy diet, and it will still take time following this routine to see results. Before increasing your exercise frequency, duration, or intensity, all signs or symptoms of exercise intolerance should be absent. This can include pain or pressure, the inability to catch your breath, nausea, cold sweats, dizziness, sudden confusion, lack of coordination, sudden weakness or numbness in face, arms, or legs, or even speech or vision disturbances. Thank you for listening to this presentation. If you have any questions, please bring them to your next cardiac rehab visit.